The 5 moments for hand hygiene form part of the World Health Organization guidelines on hand hygiene in healthcare. This is a global program aimed to decrease healthcare-associated infections. In your working environment, there are 2 zones. The patient zone, highlighted in orange, includes the patient and the patient's immediate surroundings. And the healthcare zone, highlighted in blue, includes everything outside of the patient zone. In your own workplace, you should be able to determine where the patient zone is and where the healthcare zone is. You should perform hand hygiene every time you enter and leave the patient zone. The patient zone is contaminated with many of the patient's own organisms. If introduced into a patient, they are potentially harmful. An infection caused by a patient's own organisms is called an endogenous infection. Within the patient zone, there are 2 critical sites that you should be aware of. Clean sites, such as access points for invasive medical devices, need to be protected from microorganisms, and body fluid sites, which will lead to contamination of your hands when you touch them. All items used in the patient zone, including medical equipment, should be cleaned between each patient. Bed curtains are not part of the patient zone, as they are not changed between each patient and are heavily contaminated with many foreign organisms. Hand hygiene is required before touching patients, after you have touched the curtains. The healthcare zone is contaminated with many organisms foreign to the patient. If introduced to a patient, they are potentially harmful. An infection caused by an organism foreign to the patient is called an exogenous infection. By performing hand hygiene at the correct times, you will 1. Prevent organisms being taken from one patient to another or from the healthcare zone to the patient. This is called cross-colonization. 2. Prevent infection in patients, stopping the introduction of organisms directly into the patient during invasive procedures or contact with non-intact skin. 3. Protect yourself by ensuring you do not take patients' organisms away with you on your hands. And 4. Prevent further cross-colonization of the healthcare zone, including healthcare workers. Here is an example of cross-colonization taking place. In this example, the orange dots indicate the organisms being transferred from patient A to patient B. Unfortunately, organisms are too small to be seen, so it is not possible to know when cross-colonization has occurred. You should always perform hand hygiene between each patient. Improving hand hygiene compliance is the single most effective strategy to reduce healthcare-associated infection, but many healthcare workers don't know when to perform it. The 5 Moments for Hand Hygiene program provides you with evidence-based guidelines for when to perform hand hygiene. Sometimes you will be required to perform hand hygiene whilst you are still in the patient zone. You need easy access to a hand hygiene product without having to leave the area. As an example, you can see the alcohol-based hand rub is placed at the end of the bed, enabling the healthcare worker to clean their hands at the point of care. Moment 1 is the first of the 5 moments for hand hygiene. Performing hand hygiene before touching a patient will ensure no foreign organisms are transferred to that patient. You are required to perform hand hygiene before touching the patient, their clothes, or any medical device that is connected to the patient, for example, an IV pump. To comply with Moment 1, always perform hand hygiene on entering the patient zone. Where possible, perform hand hygiene in front of the patient. Here is an example of Moment 1 taking place. Note the orange haze showing you the patient zone in this scenario. Moment 2 requires you to perform hand hygiene immediately before a procedure. Performing hand hygiene immediately before you start a procedure will prevent the introduction of organisms into the patient. Procedures are any act of care where you could introduce an organism directly into the patient's body. This includes activities such as taking a blood glucose level, inserting an invasive device, administering intravenous medications, and touching a wound. Perform hand hygiene immediately prior to the procedure. To facilitate this, you should collect and prepare all items required for the procedure and then perform hand hygiene. If you touch the patient or surroundings prior to starting the procedure, you will need to undertake hand hygiene again. If gloves are worn for a procedure, then hand hygiene is required immediately prior to donning gloves. Here is an example of Moment 2 taking place. Moment 3 requires you to perform hand hygiene immediately after a procedure or body fluid exposure risk. It is important that nothing else is touched after the procedure or body fluid exposure has taken place, even if hands appear visibly clean. This includes moving from a dirty or contaminated body site to a clean body site on the same patient. By performing hand hygiene immediately after a procedure or potential body fluid exposure, you protect your patient, yourself, and the healthcare zone from becoming contaminated with that patient's organisms. Touching the outside of a drain or drainage bag, even when the circuit is not broken, will potentially expose you to body fluids. Therefore, you should always perform hand hygiene after touching each drainage device, before touching anything else. You are also required to perform hand hygiene following a potential body fluid exposure, even if there is no patient contact. If gloves are worn, hand hygiene is still required immediately after a procedure or body fluid exposure once your gloves have been removed. Here is an example of Moment 3 taking place. Moment 4 requires you to perform hand hygiene after touching a patient. This protects you, the healthcare zone, and other patients from organisms being carried out of the patient zone on your hands. Remember, the patient includes their clothes and any medical device that is connected to them. To comply with Moment 4, you are required to perform hand hygiene on leaving the patient zone after touching the patient. It is also good practice to perform hand hygiene every time you leave the patient zone. Here is an example of Moment 4 taking place. Note the orange haze showing you the patient zone in this scenario. Moment 5 requires you to perform hand hygiene after touching anything in the patient's surroundings, even if you have not touched the patient. This includes occasions when the patient is not present. The patient's own organisms contaminate their environment. Multiple items in the patient's immediate surroundings can be touched sequentially as long as hand hygiene is performed on leaving the patient zone. It is good practice to always perform hand hygiene on leaving the patient zone. This will ensure your hands are clean before moving on to the next activity. Here is an example of moment 5 taking place. Note the orange haze showing you the patient zone in this scenario. In summary, hand hygiene must be performed before touching a patient, before a procedure, after a procedure or body fluid exposure risk, after touching a patient, after touching a patient's surroundings. By following the 5 moments for hand hygiene, you will be providing the safest possible care for your patients. If you would like more information, please visit the Hand Hygiene Australia website.